stop and listen, because small changes you notice today can protect your confidence for years, and the sooner you act, the better your results will be. If your size seems reduced, if firmness is inconsistent, or if performance is not what it used to be, you are not broken, and you are not alone. Penile shrinkage is often a sign of change in blood flow, hormones, and tissue elasticity, not a permanent fate. With clear steps, you can protect function and, in many cases, regain what you think you lost. I am Dr. Zara Vale, a urologist focused on men's health. My goal is simple: to give you practical actions that actually work. Clinical studies show that penile tissue responds to blood flow, oxygen, sleep-driven hormone rhythms, and routine mechanical stimulation. When those inputs improve, tissue quality and performance improve. Today, I will walk you through the 6 habits that quietly drive shrinkage, and the 6 science-based strategies that help you maximize your size and protect function. First, let us be honest about the biology. As men age, blood vessels can stiffen, nitric oxide signaling can slow, and the inner lining of arteries can lose responsiveness. That means less oxygen delivered to delicate erectile tissue. At the same time, drops in testosterone and rises in abdominal fat can shift metabolism and reduce the regular nighttime erections that keep tissue elastic. This process is called atrophy, and it affects firmness, sensation, and your sense of self. The important truth is that tissue adapts, and when you improve the inputs, the output changes. Habit 1. Ignoring blood flow. Reduced circulation starves tissue of oxygen and nutrients. The result is flatter, softer, or smaller-looking erections. Many men notice changes first on cold mornings or after heavy meals. That pattern is a blood flow story. Habit 2. Losing nocturnal erections. Healthy men typically have several nighttime erections during deep sleep. They act like physiologic maintenance. When sleep becomes shallow or irregular, that natural workout fades, and tissue loses elasticity. Habit 3. Low sexual activity. Regular erections are mechanical stimulus. They stretch smooth muscle, bring oxygen, and maintain structure. Long gaps often lead to slower response and more shrinkage over time. Habit 4. Low testosterone. After 30, levels tend to decline each year. Low testosterone reduces nitric oxide production, energy, and libido. It can also change body composition in a way that makes the penis appear smaller relative to abdominal fat. Habit 5. Insulin resistance and central weight gain. Extra abdominal fat drives inflammatory signals that harm blood vessels and blunt hormonal signaling. Men often see both reduced length and girth with increased waist size. Habit 6. Processed diets, inactivity, and poor sleep. These combine to push inflammation up and testosterone down. You feel tired, less confident, and less ready, and the tissue follows the chemistry. Now, the plan that helps. These are not gimmicks. They are practical, evidence-driven moves that many men can start today. Strategy 1. Boost nitric oxide and vascular health. Eat leafy greens, beets, citrus, and pomegranate regularly, and reduce ultra-processed foods. Research shows that dietary nitrates and polyphenols support endothelial function and improve circulation. Better flow means better oxygen delivery, and better oxygen delivery helps preserve size and firmness. Aim for 2 servings of greens each day and keep meals lighter in the evening. Strategy 2. Stabilize sleep to restore nighttime erections. Target 7 to 8 hours, keep a regular schedule, and dim bright screens well before bed. Studies link deep sleep with pulses of testosterone and reliable nocturnal erections. The more consistent your sleep, the more natural maintenance your tissue receives. Strategy 3. Move your body most days. Combine brisk walking or cycling with simple resistance work. Even 20 minutes of bodyweight exercises can raise nitric oxide, improve insulin sensitivity, and support testosterone. Men who train regularly often report stronger morning erections and faster arousal, which maintains tissue elasticity. Strategy 4. Maintain sexual activity. Partnered intimacy or solo stimulation 2 to 3 times per week provides oxygenation and stretch. Frequency matters more than intensity. Regular engagement keeps the system responsive. Think of it as physical therapy for an organ that depends on blood and use. Strategy 5. Measure and manage hormones. If you notice low drive, low morning energy, or shrinking size, get tested. When true deficiency is confirmed, supervised treatment can restore levels, improve mood and muscle, and support erection quality. Evidence shows that correcting deficiency improves erectile parameters in appropriate patients. Make decisions with a qualified clinician and retest to guide the dose. Strategy 6. Consider safe tools with medical guidance. A well-fitted vacuum device promotes blood flow and gentle stretch, which supports tissue health, especially after prostate procedures. Some men also use L-arginine, pomegranate extract, or pine bark extract as adjuncts. Research suggests these compounds support vascular function. Treat supplements as additions to lifestyle, not replacements. Discuss them with your clinician if you take other medications. Here is how these strategies fit together. Better diet and daily movement increase nitric oxide, which improves arterial relaxation. Better sleep increases testosterone pulses and restores nighttime erections. Regular sexual activity keeps tissue oxygenated and elastic. Managing hormones addresses a key driver of function. The result is better blood delivery, healthier smooth muscle, and a more reliable response. Progress takes patience. Some men notice stronger morning fullness within weeks. Others see gradual gains over months as sleep, weight, and energy improve. Both outcomes are wins, because stopping loss is as valuable as a visible gain. What matters most is consistent action. Choose 2 changes today, such as greens at lunch and a 20-minute walk after dinner, and build from there. Your sexual health is not cosmetic. It is part of your dignity, your relationships, and your daily confidence. Clinical evidence shows that men in their 60s, 70s, and beyond maintain satisfying sexual lives when they protect blood flow, sleep well, keep moving, and treat real hormone deficiencies under supervision. You can start that path today. If you feel discouraged, remember this. Tissue adapts to the demands you place on it. Feed it blood. Give it oxygen. Maintain healthy hormone rhythms. Use it regularly. The body responds to what you do most consistently. Start now, keep it simple, and stay with it. Your size, your function, and your confidence are worth the effort, and your results are still in your hands.